Good day everyone, I'm Johnny Balmeo and I will be your clinical instructor for this lesson. Once again, welcome to NCM 104, also known as the Community Health Nursing 1 Skills Laboratory. So today we will have a little discussion about the CHN-OB bag technique, and then later on we're going to discuss about the checklist and principle, and then last will be the demonstration of the CHN-OB bag technique to you guys. So first of all, what is bag technique? Bag technique is actually a procedure used by a PHN or the public health nurse or the community health nurse to perform certain nursing procedure with ease and deftness. So in other words, this is to lessen the time and effort in rendering care. Next, what is public health bag? Public health bag is actually also known as the OB bag. This is actually a tool in which the nurse used to store necessary materials, articles, and even medications. Well, there are actually different kinds of OB bag. The usual is the black one that we are using. Well, there are also other OB bag like backpack style. Then before, in the old batch, they use actually a mail bag type. So iba-iba pong klase ang OB bag. So next, what is the rationale behind the OB bag? So the rationale is to render effective nursing care to client and or members of the family during home visit. Now let's talk about the principle. The first principle is what? To minimize, if not totally prevent the spread of infection. It is really impossible actually to make your OB bag sterile, but at least we need to lessen the infection. Next, bag technique should save time and effort, and at the same time, energy, so you can focus to your primary objective. Next, bag technique should not overshadow concern for the patient. Well, your OB bag is not your primary concern actually, rather the family. So yun dapat na maging focus mo, not the OB bag. The next, bag technique can be performed in a variety of ways. Huwag mong limitahan kung anong kakayahan ng OB bag mo. It can actually store many things. It can store many things. But lagi natin tandaan that it should avoid the transfer of microorganism or infection. For example, the stethoscope and sphygmomanometer. You can say na we can place the stethoscope inside the OB bag But actually, hindi. Bakit? You are using the stethoscope and then the sphygmomanometer most of the time. So, most probably, it can get an infection, or should I say microorganism. Hindi mo pwedeng basta na lang ilagay inside your OB bag. Okay? Next, the bag should contain all necessary articles. Well, especially in times of emergency needs, so that when the emergency arises, you can actually perform and help those who are in need. I remember in our previous CHN, there was actually a case where a kid got wounded by a nail. So we performed easily our task because we have the materials that we needed. Next, the bag and its content should be clean as often as possible. So kailangan we need to use different disinfectants, and most of the time we use alcohol to sanitize or disinfect the materials that we use, and even that we use for the tools na ginamit natin, and even the OB bag, kailangan linisin din natin yun. Next, consider the bag and its content clean, and then the surroundings or the articles na magkakaroon ng contact dito will be, should I say, contaminated. Then, number 4, the arrangement of the content of the bag should be there, one most convenient to the user to facilitate efficiency and avoid confusion. It should be arranged properly, guys, so you can easily grab what you needed. I advise na you can put unnecessary materials at the bottom of your bag, while those important should be at the top. Para kung ano man yung kakailanganin mo na madalas mong ginagamit, you can easily grab those. Next one, hand washing is done frequently as the situation calls, or as much as possible kapag magpe-perform tayo ng procedure, before and after. The next, the bag when used for a communicable case should be thoroughly clean and disinfected. So I already told you guys na gamitin natin yung alcohol to sanitize. Yung tools na gamitin natin, and of course, yung OB bag, especially the strap. Now, what are the contents of your OB bag? We have, first, the paper lining. This is where we place our OB bag. Next one is extra paper for making bag for waste materials. We advise our students nowadays na gumamit na lang ng brown bag kasi you do not have to make a paper bag, rather gawa na siya. So yung brown bag will be appropriate for this one. What else? Plastic or linen lining. Para saan to? Dito natin ilalagay yung mga materials natin. What else? Apron. Napaka-importante po niyan to prevent contamination and of course to prevent the spread of microorganisms. What else? Hand towel in plastic bag for drying of your hands after hand washing. Soap in soap dish, of course, for the hand washing too. Digital thermometer in a case. What else? 2 pairs of scissors. 1 surgical and 1 bandage. What else? 2 pairs of forceps. 1 curved and 1 straight. This one will be used for cleaning of wounds and many things, of course. Syringes, we have 5 ml and 2 ml. Hypodermic needles, gauge 19, 22, 23, and 25. What else? Sterile dressings. The sterile dressing will be used for the wound dressing. We also have sterile cord tie. For the sterile cord tie, maybe you can just ask me for the rationale why we have to include the sterile cord tie in our consultation na lang. What else? Adhesive plaster for the wound dressing. What else? Dressing. We have the operating sponge and then the cotton balls for the wound dressing then. Alcohol lamp. This one will be used for the ascetic and Benedict test. Tape measure for measuring the height of the infant or the newborn. Baby scale. We do not actually advise to use the baby scale, lalo na kapag nag-iikot tayo in the community. Rather, we use the Salter scale kasi mas portable siya kumpara dito sa may baby scale. What else? 1 pair of rubber gloves, pero we advise our students to use the medical gloves and also a pair of sterile gloves. So, dalawa. 2 test tubes for the ascetic and Benedict test. Then, of course, test tube holder. Now, for the medicines, we have betadine, 70% alcohol, ophthalmic ointment. So, ophthalmic ointment is actually used for the newborn sa may mata ng mga newborn. The Zephyrin solution, ginagamit for the disinfectant. Hydrogen peroxide para sa may sugat. Spirit of ammonia. If we encounter a person who just lost consciousness, we can use the spirit of ammonia. Acetic acid, and Benedict solution. So, those are the contents of your bag. Now, we will move on to the demonstration time.
For the demonstration time, let's start with the assessment. Assess the completeness, neatness, cleanliness, and availability of bag contents and its proper arrangement. Determine the needs of the clients on the basis of findings during home visit. Blood pressure apparatus and stethoscope are carried separately. For the planning, prepare all the equipments needed. For the implementation, carry the bag properly. And then, upon the arrival of the client's home, place the bag on the table or any flat surface lined with paper lining. Clean side out. Put bag's handles or strap beneath the bag. Ask for a basin of water and a glass of water if the faucet is not available. Place this outside the work area. Open the bag, take the linen or plastic lining and spread over the work area. Now take out hand towel, soap dish, and apron and place them at one corner of the work area. It should be within the confines of the linen or the plastic lining. Now do the hand washing. Wipe dry with a towel. Leave the plastic wrappers of the towel in the soap dish in the bag. Next, put on apron, right side out and the wrong side with creases touching the body, sliding the head into the next strap. Tie the straps at the back. Now, put out things most needed for the specific case. For example, thermometer, kidney basin, cotton balls, waste paper bag, and place at one corner of the work area. Place the waste paper bag outside of the work area, then close the bag. Now you may now proceed to the specific nursing care or treatment. After completing nursing care or treatment, clean and alcoholize the things used. Do hand washing again. Open the bag and put back all articles in their proper places. You may now remove the apron folding away from the body with soiled side folds inwards and the clean side. Place it in the bag. Fold the linen or plastic lining. Clean. Place it in the bag and close the bag. Now for the evaluation. Reassess and evaluate the comfort of the client after the nursing care. Look for other needs of clients or families pertaining to their living conditions. For the documentation, record all relevant findings of the client and members of the family. Make post-visit conference on matters relevant to healthcare, taking anecdotal notes preparatory to final reporting. Then make an appointment for the next visit, either home or clinic, taking note of the date, time, and purpose. Just a note, before keeping all articles in the bag, clean and alcoholize them.